How about in general? You are in the CDC. What do you know about in general?
Right. Well, again, thinking specifically about what's going on with autism, we have been looking at trends over time, and as you point out, there has been an increase. We do know that some of that increase is due to how children are identified and diagnosed in the community. So there have been changes over time that contribute in part. Our system monitors the number of children. We don't have all the information about what's happening in the context that influences how children are identified.
I guess what I'm saying is, and these are your words, not mine, as we've seen this remarkable acceleration just in the diagnoses, and in your words it was, this is a public health concern. Would you explain to me why this is not a public health crisis? Why this isn't an issue that is on the front burner of the CDC every day?
This is a very important issue to the CDC, and we are using the strengths of CDC to approach this issue.
What is being done to have a genuine, comprehensive plan in which we are looking for accountability year to year on the progress that's being made and in terms of what we're doing to better understand this issue?
It's a very important question, Congressman. I think part of it, again, goes back to the IACC having been created and asking for it to every year come up with an updated plan. And I can tell you, I haven't checked my emails in the last couple of hours, obviously, but based upon simply the flurry of activity over the last few days alone, there really is work amongst
flurry
multiple...
because of our hearing, or flurry just...
No, because it's that time of year. We're aware that the year is coming to a close, and really trying to put together this year's plan in a very thoughtful way, looking at all of the research...
Who's in charge of this? Who wakes up in the morning and says, this is my priority, I am going to drive this train and make sure something happens today? Who's in charge of it?
I'd say there are a number of people that are doing it.
I hate to say it, there's so many different aspects of there, but as an outside observer, I see it as being sort of willy-nilly, and this is the next thing that gets funded today and somebody tomorrow, as opposed to a real focus on a critical path.
Dr. Boyle, you mentioned in answer to Mr. Burton's question that since 2000, Temesterol was removed from all of the vaccines except the multi-vial for vaccines on that basis. Can you answer me why, just as a matter of precaution, to eliminate that whole issue, it isn't removed from them as well?
Actually, I said since 2001, and I'm not a vaccine expert, but my understanding, and I will clarify for the record about this, is that the multi-use vials are used, are needed. And
so my colleague was talking about diet and other family incidents like that. Is there part of this monitoring that entails going into an area with a very high incidence of autism diagnosis and actually interviewing those families to find out what might be distinctive about their experience or their history?
Now, I do represent an area that has impoverished rural areas, and I'm sure a lot of the members feel the same way, because we don't all represent just one group of people, but a lot of people. So how are people in the impoverished areas, how do they get access to this? How do we get to them? How do we give them the opportunity to find out what it is that they need to know also? Is there a method that... I keep hearing people, they can go online. Well, the area that I represent, there's not a lot of people that can go online to do this. So,
and the IACC is really trying, and I know it has its challenges, but it's really trying to bring together all of those voices in the federal government in a coordinated way, so that we can really help everyone. Really be the group that reaches out to all.
Dr. Boyle, anything on the horizon at all? Anything you see coming that could be a cure?
Again, we've been focusing on understanding the preventable causes versus the cure part.
Okay. Well, I want to take this opportunity. Mr. Burton and I share an awful lot of passion for a lot of different things, but we're both grandparents. I've often said if we could ever exchange and take the place of whatever it is that our children, our grandchildren, we would gladly do so. So I thank you. He's departed again, but what a great effort, and I think Mr. Meehan hit the nail on the head. We will continue to pursue this as long as we can. You deserve an answer, and we'll keep working towards that means.
And I read not very long ago an article that it said until the wonderful people like us introduce vaccinations to Africa, the African children basically were autism-free. They never heard of autism, never had a case of Down. Are you familiar with that? Have you ever heard that before? Okay. I wonder if the CDC has conducted or facilitated a study comparing vaccinated children with unvaccinated children yet. Have you done that?
We have actually done a number of studies looking at the relationship between thimerosal vaccines and autism and other developmental disabilities. And
so clearly, definitely, unequivocally, you have studied vaccinated versus unvaccinated.
We have not studied vaccinated versus unvaccinated.
Oh, that was, okay. Never mind. Just stop there. That was the meaning of my question. You wasted 2 minutes of my time. Vaccinated versus unvaccinated.
We have not studied vaccinated versus unvaccinated.
Oh, that was, okay. Never mind. Just stop there. That was the meaning of my question. You wasted 2 minutes of my time. What steps has the CDC undertaken to ensure the integrity of the research that was performed by Dr. Thompson, who, as you know, has been indicted for misconduct and misallocation of resources?
So Dr. Thompson, who is a co-investigator on a couple of studies that came out on autism, was really just one investigator, and that body of evidence related to vaccines and autism.
All right. Have you gone back to validate the variety of studies he participated in? I mean, you know, this guy is a humongous scumbag, one of the most wanted men on earth, and you relied upon him for data to determine whether thimerosal had a negative effect. I've seen a chart that ranks the longevity of the 30 nations with the best mortality rates in the world, starting with Iceland, Sweden, Singapore, and on down. We didn't even make the top 30. We're the 34th. And ironically, we require more vaccinations than any other country that's healthier, has a less mortality rate than us. Do you see any correlation whatsoever, either one of you, to the 34th worst mortality rate and the most vaccinations to the ones with the least required vaccinations and the lowest mortality rate?
The one thing we do know about vaccinations is that they are among the major public health reasons why generations today live much longer than in previous generations. They are perhaps the most successful public health movement in the world.
Nobody's talking about or against vaccinations.
Well, I was just trying to
talk about thimerosal in vaccinations.
I was trying
and multiple, bomb blast of vaccinations in short period of time on very. Thank you, Mr. Chairman. My time's up.
I'm sorry, gentleman's time's expired. Did you want to answer?
No, I think I had an opportunity. Thank you.
Okay, very good.
The bottom line is you asked two questions rather than perhaps answer it. And again, you've got to go where the science is, and I deeply respect that. But it is now a couple of years later, and I would appreciate it if the jury is still out, whether or not it's just better surveillance, especially in light of what Autism Speaks has discovered in South Korea. The 1 in 38 study that they funded makes it very clear that when you go further into a study, into the weeds in terms of asking the right questions, more rather than less seems to be the case. And I'm wondering if you could comment on that South Korean study. We never saw a prevalent spike like we've seen on autism in Africa as we have seen in the last 15 or so years.
Now, the numbers that he pointed out earlier, that it used to be 1 in 10,000 kids got autism, it's now 1 in 88. And I'd like to ask Dr. Boyle why. And I don't want to hear that we have better detection. We have better detection, but detection would not account for a jump from 1 in 10,000 to 1 in 88. That is a huge, huge, huge jump. What other factors could be part of making that happen besides better detection? Take better detection off the table. I agree we have better detection, but it doesn't account for those numbers.
So just to put it in context, better detection is accounting for some of it.
Right, I know some, but what other factors? I don't want to hear What other factors?
Our surveillance program counts cases of autism and establishes the prevalence. It doesn't tell us all the answers to the questions as to why. We've tried to look at what's changed in the environment of things that we know are risk factors for autism, things like preterm birth and birth weight and various...
Well, are you looking at vaccinations? Is that part of your studies?
So let me just finish this one.
I have a question. Are you looking at vaccinations? Is that part of? Pardon me?
So there is a large literature, as I mentioned.
Are you having a study on vaccinations and the fact that they're cramming them down and having kids have 9 at one time? Is that a call? Do you have any studies on vaccinations?
There have been a number of studies done by CDC on vaccinations as
well. Could you send them to the ranking member and the chairman here? I must have had 50 different parents write me or come to me and say I had a healthy child, yet then they had 10, 9, 6 vaccinations at one time, and that child changed overnight and was knocking their head on the wall, and it was a changed child. In fact, I had a family in my office today where the mother broke down crying, saying my child was wonderful, bright, precocious, talking. She took those vaccinations, and the child became very incredibly sick and has never recovered. But why do you have to cram 9, 6 at one time when the verbal evidence seems so strong from so many people that they had a healthy child until they got vaccinated?
And that's why I don't know that we're spending enough time and energy looking at this where our kids are getting twice the shots of everybody else. And I just have, my sons, it seems like they're older now in their late 20s, but they might have had 7 or 8. And I'm just going by people that I represent in our area that feel strongly that this has to be looked at in a very, very aggressive way, that if we're over-vaccinating our children. And I'll doctor either one of you.
42,000 lives were saved, 20 million cases of disease were prevented, and $13.6 billion in direct medical costs were saved.
When you put all these drugs or vaccines into children, the impact that these various vaccines might be having, combinations, that's the number I got.
I don't have a specific number. I'd be happy to provide additional information for the record on.
But I think it's 2.3 million, and they say that it costs the country. I didn't realize it was to this magnitude, $137 billion a year in annual cost this country for care of autism. Do you agree with that number? Either of you?
Again, I would not have the data to agree or disagree. I know that it's a high number.
Okay, well, I just want to let you know we've got to spend more time and resources and fix this problem because it's obviously out of control.
There's something wrong. And, the gentleman, I thought, asked some very good questions. As a matter of fact, the whole panel. When you've got this combination of shots, and you go from 1 in 10,000 to 1 in 88, it seems to me somebody would say, wait a minute, let's put the brakes on this. Just look at, whether the multiple shot situation is causing this. And I wish you could see the people behind you. They're grown men that have been crying behind you, and women crying. And it's just so I just hope that we can. You hear the frustration coming from here, and I'm just sitting here and I'm just saying, wait a minute. It just seems like somebody would say, is there something? Maybe there's an issue here, and if we're going to err, let's err on the side of keeping children safe, even if we have to, do a pause and get 1 shot a day. Thank you very much. I thank the gentleman for yielding.
If I may take a liberty of the chair for a moment, it is our intention to include in future hearings, and the gentleman from Indiana is here, a narrow but specific request, and I put both of you, even though you may not be the witnesses, of the question of drug interactions where the FDA approves individual drugs and individual vaccines, but by definition does not necessarily thoroughly study interactions of any sort that can happen with 1, 5, 9, 20 different ones. That's a different hearing.
We've heard a lot about the 1 in 88 number. I come from a state where it's 1 in 47. I've heard a lot about this from my constituents, and I've always been an advocate for responsible funding and research for NIH to try to figure out what's going on with this issue. Can any of you tell me about any new therapy